All right, I'm going to be demonstrating how to use the Explorer on the maxillary anterior facials. So this is for number 7 through 10 maxillary. So for all surfaces towards, you split the tooth at the midline, and for all surfaces towards, you're going to be sitting at an 8 o'clock position, 8 to 9. And then for all surfaces away, you're going to be sitting at a 12 o'clock position. And again, that's dividing the tooth at the midline. These are surfaces away, and then these are surfaces towards. So I'm going to be using this little doll here to show you the right working end. So you want to make sure that the shank crosses over. So this is not the right working end because it bulbs out. This is the right working end for surfaces towards. So I'm still in an 8 o'clock position, but this is crossing over for surfaces towards. And you want to actually start at the midline of the tooth. You can see that, midline of the tooth. And then you want to do vertical strokes. And you want to roll. That's how you find the right working end. Again, it goes over the tooth, the long axis of the tooth, so you're able to roll into the distal. This is the wrong working end for surfaces towards. Because these are maxillary teeth, your patient is in a supine position, and you can have them turn slightly towards you to help out, but they're not in a semi-supine because that's mandibular. So supine position. I'm going to talk about pen grasp. So for pen grasp, you want to make sure that you have your C shape, and then you want to make sure that you are using your middle finger for tactile sense to feel for any calculus lightly, and then you want to make sure that these are all connected, and this is your fulcrum finger. So you have your fulcrum, your middle finger for tactile sense, and then you have your modified C. You're going to be making sure that you're rocking your wrist, you're rolling into interproximal surfaces, and then you're pivoting up on your fulcrum. For surfaces towards, it helps to have a palm up position, and then as you roll, you're going to go palm down. And then it also helps to not be so high up on your hand. You want to be more down, pointing towards the patient's belly button, so you're able to rock your wrist a little bit better. So we'll do some practice strokes. So again, you want to make sure that you are finding the right working end of the instrument. This is crossing over the long axis of the tooth. This is a big tooth, but you want to make sure that you're starting at the midline. You have your modified pen grasp, and then your fulcrum. And then you want to make sure that you are taking vertical strokes. And then you want to roll into the distal. And this is just for surfaces towards. Again, vertical strokes. And you're rolling. So now for surfaces away, your patient's at 12, like I said, and they're in a supine position because it's maxillary teeth. You want to start at the midline, and then I will show you up close how to find the correct working end. You find your fulcrum and your palm up, and you want to be at the midline of the tooth, vertical strokes, and you roll. And I'll show you up close. All right, now we're up close. Again, I have the big teeth, and this is the wrong working end because it wraps not around the tooth, the long axis of the tooth. This wraps over the tooth, or would, rather. You start at the midline, and again, you're taking vertical strokes. You're using your rock, your roll, your pivot, and you're going into the interproximal surface. Starting at the midline, vertical strokes, rolling into proximally. So you have your modified C, you have your light touch for tactile senses, and then your fulcrum. You want to make sure you're not blanching your fingers.